Dr. Scott, I'll start with the questioning. I'll just basically turn it over to Mr. Siri. Do you want to start with the 154 million claim? But we had the ranking member, and we also had Dr. Scott say that the Henry Ford study was highly flawed by design. Do you want to maybe start there and defend the Henry Ford study?
Whatever you would like, Senator, I'm happy to do that, yes. Thank you. Happy to start wherever you'd like. In terms of the Henry Ford study, I appreciate Dr. Scott's comment, but I don't believe Dr. Scott has actually read my submission, if given his comments about what he believes makes this study fatally flawed. He points to one thing. He calls it detection bias, because what he's saying is that the vaccinated children are more likely to seek medical care than the unvaccinated children. Had he read my submission, he would have seen that the study authors who were looking to validate the safety of these vaccines specifically conducted sensitivity analysis to see whether there was detection bias. How did they do that? What they did is they looked at the average number of times that the vaccinated cohort sought medical care versus the unvaccinated. And what they found was vaccinated children sought medical care on average 7 times a year. Unvaccinated sought it twice a year, which would make sense if you have less illness. But for the unvaccinated kids, those 17% that had a chronic health issue, they sought medical care on average 5 times, which reflects that when an unvaccinated child had a medical issue, they did go see the doctor. Number 2, as the study points out, the type of health conditions that we saw in the unvaccinated population are not ones you wouldn't see medical care from. If your child has a serious medical condition, you're going to your doctor. You're going to the medical system. That's not me saying it. That's what these study authors pointed out. Also, to further validate their findings, they even reran their study to remove any child that didn't seek any medical care. So essentially, they removed the healthiest unvaccinated children, another sensitivity analysis they did, and they still found the statistically significant outcome that that I discussed earlier. Now, the other thing they did to make sure that their results were valid, and again, I assume they did this because they wanted to try and do exactly what Dr. Scott is saying. Well, there's got to be a mistake here. It can't be that this is true. And so the other thing that they did is they conducted a sensitivity analysis whereby they removed any children from the study that weren't in the Henry Ford system from birth onward for at least 5 years, thinking, okay, well, maybe we, got it wrong because the unvaccinated kids, had an average duration of less time. But so by doing that, we're only going to look at kids who were in there for at least 5 years. And what they found was, consistent with the findings, affirming the findings, the risk ratio of chronic disease amongst the vaccinated went up, not down. They also did that sensitivity analysis at 3 years and at 1 year. And each time they still found the vaccinated children a statistically significant increased rate of chronic health issues. They also used cancer as a control, assuming, well, there's no reason vaccines should cause cancer, and they didn't find a statistically significant outcome. So the issue that Dr. Scott points to in a study, which, by the way, he's labeling fundamentally flawed, there was enough information in my submission to have understood what I just said.
He actually said it was flawed by design. You know the study authors of this thing that the people conducted. Do you believe these are professionals that would design a study by design to make it flawed, to give a result that vaccinated children suffered chronic illness 2.5 times? I mean, that's basically what Dr. Scott is saying to the authors of this Henry Ford study.
I mean, I think from the perspective of the establishment, this study is flawed because it's actually designed to detect safety. It's actually designed to reach a conclusion on safety. That's what makes it flawed. It's not like the aluminum study that Dr. Scott pointed to, which he called, rigorous.
Let me, so you can get down
Yes.
in the weeds very quickly, and you have to, quite honestly.
Yes.
It's just true. But let's pull it back a little bit. I heard for the first time during the RFK Jr. hearing that there's been a study that vaccines have saved 154 million lives. You have a somewhat interesting take on that. Do you want to talk
sure.
a bit about that scientific gem?
Absolutely. Absolutely. I think the claim about 154 million lives saved is it actually is the epitome of the corruption of science. It reflects the corruption of science in action. While this Henry Ford study, for example, is based on actual data, medical records, the immunization registry, and look carefully at it, this study is just based on guesswork and assumptions. It is a study published by the WHO. It is essentially an advertising piece by them for how effective their immunization program has been over the last 50 years. And they claim there's 154 million lives saved. But when you look at this study, unlike the Henry Ford study, it has no confidence intervals. So what is the confidence interval of that 154 million claim? What is the reliability range of it? It doesn't have one. You know why it doesn't have one? Because it's totally unreliable. As buried in page 42 of the supplement to that quote-unquote advertising piece by the WHO, it's in a section entitled Uncertainty of Estimates, it says that, quote, it cannot put, quote, bounds around the veracity of the estimates. It can't put bounds around the veracity of the estimates. And that, quote, any bounds are arbitrary, end quote, and that, quote, it should not be interpreted as a claim to where the edges of valid estimates possibly lie, end quote. What that means is it could be equally true that 200 million lives were lost because of the vaccine program. It's an unbounded estimate. That is the corruption of science, to rely on that. And it gets worse from there because, and when you actually look at the hard data, the number makes no sense. Almost the entirety of that 154 million lives saved comes down to two vaccines, DTP and measles vaccine. Well, as laid out thoroughly in my submission, the studies that look at DTP vaccine show that it causes more mortality, far more mortality, than lives saved. While it may reduce deaths from diphtheria, tetanus, and pertussis, the studies show numerous rate the kids. The seminal study showed that the kids who got DTP died at 10 times the rate, 10 times the rate, than kids who did not get that vaccine. And that is, I'll give the PubMed number, it's 5360569. And that study is not just one study sitting on its own. It comes after a long series of studies. It was published in 2017, and then another one in 2018. And DTP is the most commonly used vaccine in the world. That's what the science, based on hard data, that has confidence intervals, shows. Not this WHO advertising report with no confidence intervals. The other vaccine that accounts for almost the entirety of the 154 million lives saved is the measles vaccine. The study assumes, I guess to its credit, that 60% of that decline was from other factors, and 40% of the decline in measles mortality was from the vaccine. But here's the thing. When you look at the decline in measles mortality in other countries when there were no vaccines, like the US, between 1900 and the first vaccine in 1963, measles mortality declined by 99%. That's CDC data, not assumption. When you look at the UK data, between 1900 and 1968, when they first started the first measles vaccine there, measles mortality there declined by 99%. So when you overlay that number, not use a 40% decline, but 99%, and then you add in the increased deaths from DTP, you're upside down already. That's why they can't put a bound on their 54 million lives claim. Those vaccines cost a lot more than $154 million.
Let me give Senator Marino a chance. Okay.
May I ask one last point on this, and I will stop. I'm sorry. And it's this. As I've laid out in my submission, study after study after study shows that people who get measles vaccine die at far less lower rates from heart disease and from various cancers. It's not me saying that. I'm just a lawyer, as Senator Blumenthal pointed out, okay? But that's what the studies show, and they're consistent. They're an inconvenient truth when it comes to the medical establishment. When you add in that data as well, it's really upside down. I lay that out, including a 100,000 person, 20-year prospective study in Japan that found that those who got measles and mumps, about 7% were dead from heart disease after about 20 years, whereas those who didn't get measles and mumps, around 14% of them were dead after 20 years. Heart disease is the #1 killer of folks in the United States. I'll stop there.
We'll continue. Senator Marino.
Thank you, Mr. Chairman, for